I am Antonio Popolo Rubio. I'm an interventional cardiologist from IRCS Policlinico San Donato in Milan, and I'm here to present the results of a multi-center Italian registry about the use of MitraClip in atrial functional mitral regurgitation. As regards the background of the study, we investigated this new specific subtype of functional mitral regurgitation, which is the so-called atrial functional mitral regurgitation. This term has been introduced recently in the last 10 years, and we consider atrial functional mitral regurgitation in patients with preserved ejection fraction with a left atrium dilation in presence of mitral annular dilatation. So it's a new subtype of etiology of functional mitral regurgitation, and we do not have specific data about the outcomes of this etiology in the percutaneous setting. So based on this, we decided to investigate the acute outcomes with the MitraClip and then the midterm outcomes with a clinical and echocardiographic follow-up. The MitraClip procedure is an interventional procedure upon the mitral valve for mitral regurgitation, and it is indicated in patients considered at high risk for surgery, especially elderly patients. With the MitraClip, we have many data regarding the outcomes in primary mitral regurgitation and also the functional etiology. And in our study, we investigated a subset that was not investigated before and which is not specifically addressed by the current guidelines. We have, of course, specific criteria of selection based on the anatomy, and in this regard, atrial functional mitral regurgitation has not specific criteria since yet. As regards the study design, we conducted a multi-center retrospective registry involving 7 Italian centers at high volume for the MitraClip procedure. And in this case, we analyzed retrospectively more than 1,100 patients with functional mitral regurgitation. We evaluated if the patients presented the inclusion criteria we defined before in the study. And then we selected 87 patients that were namely diagnosed with IFMR. So after that, we analyzed the acute technical success of the procedure after the MitraClip, and we followed the patients at 30 days and then the midterm follow-up of 2 years, in which we analyzed a composite primary endpoint of overall cardiac death and heart failure hospitalization rate. From this study, we got several important information. At first, epidemiological data, because after this retrospective analysis, after analyzing more than 1,000 patients, we found that IFMR presented a rate of about 80% of our cohort of functional mitral regurgitation patients. And we also observed that IFMR etiology was more frequent in women, and this is a result which is in line with previous studies and cohort that investigated IFMR in other settings, maybe because of the high prevalence of heart failure with preserved ejection fraction in women. Secondly, we found that IFMR did not particularly affect the technical success of the procedure that was high, with the embarked technical success after the MitraClip of 97%. And the cumulative date at 30 days was of 5%, considering that we have also a very elderly cohort because the median age of our population was 81 years old. And then we also analyzed the 2-year Kaplan-Meier freedom from heart failure hospitalization and overall cardiac death, and we found a rate of freedom from this endpoint of 55%. And if we compare these results with other sub-study of patients with FMR and atrial fibrillation, we found that this rate is higher, and maybe because despite the presence of atrial fibrillation, which is a well-known negative predictor of outcome, in virtue of the preserved ejection fraction, patients with IFMR present a better outcome when compared to patients with ventricular phenotype. The patients that can benefit from this procedure are patients with a documented history of atrial fibrillation, so patients with heart failure with preserved ejection fraction with normal mitral valve leaflet, so we do not have degenerative pathology or mixed etiology. and especially patients in optimal medical therapy who are symptomatic despite the use of the optimal medical therapy. And our results confirm that the MitraClip procedure can be safe and effective also in the elderly cohort. The next step to investigate are surely define the echocardiographic selection criteria for defining IFMR, and it would be important especially for trials and registries design, and then also to think about the possibility of combined percutaneous treatment, for example MitraClip and direct or indirect percutaneous annuloplasty, especially in patients with severe dilated mitral annuli.